Just one simple mistake while taking Viagra left a man in the emergency room with an excruciatingly painful erection. In another case, a 46-year-old man even experienced a heart attack after taking this blue pill. If you think Viagra is just a magic pill for instant performance, think again. Used right, it can help. Used wrong, it can be dangerous. Today, I'll break down exactly what to do, what not to do, and the common mistakes to avoid, so you get results safely. Viagra, or sildenafil, is one of the most prescribed medicines for erectile dysfunction. It works by increasing blood flow to the penis. But here's the thing, it only works when you're sexually stimulated. If you are not in the mood, the pill won't do the work for you. First, let's see what you should do while taking Viagra. Time is crucial. Take Viagra about 30 to 60 minutes before sex. It can keep working for up to 4 hours, but peak effect is usually within the first 2 hours. Now, let's talk about the dose. The standard starting dose is 50 milligrams, but your doctor might adjust it to 25 milligrams or 100 milligrams, depending on your health. Don't change the dose yourself. Higher isn't always better. Watch what you eat because a heavy or high-fat meal can slow down absorption and delay the effect. If you want it to work faster, take it on an empty or light stomach. Inform your doctor about all medications. This is crucial because Viagra can dangerously lower blood pressure if taken with certain drugs, especially nitrates or some alpha blockers. These medicines are normally used for chest pain, blood pressure, and prostate issues. Now the important part, what you shouldn't do while taking Viagra. Don't mix with nitrates or poppers. This combo can cause a sudden, dangerous drop in blood pressure, even lead to collapse or heart attack. Remember, more than one dose in 24 hours is unsafe. Doubling up won't make you extra ready. It only raises your risk of side effects, so avoid taking extra dose without consulting your doctor. Alcohol plays a big role while taking Viagra. Too much alcohol can make it harder to get an erection and increase side effects like dizziness or low blood pressure. Now the important thing you should remember, Viagra needs sexual stimulation to work. Without arousal, it's like turning on a tap with no water supply. Viagra is not recommended for people with sickle cell disease, sickle cell trait, leukemia, or multiple myeloma, as they have a higher risk of developing priapism, a painful erection lasting more than 4 hours. This is a medical emergency, and if not treated promptly, it can lead to permanent erectile dysfunction. Like other medications, Viagra also has a few side effects. Most men may experience mild headaches, flushing, indigestion, or a stuffy nose. However, if you experience chest pain, sudden vision or hearing loss, or an erection lasting more than 4 hours, seek emergency medical help immediately. If you have any queries or concerns, let me know in the comments section.